If we talk about particularly Ahmedabad, the city where we are living, so almost 13 to 50% of the patients, they are having diabetes. This stress is useful. They are almost same. So wheat GI is say 71, Bajra is 68. So what is the difference? Once the patient is taken up for bariatric surgery, you do the surgery, and you will not imagine that maybe on the second or third day your diabetes would go. It's the magic.
Welcome to Food Pharmacy Podcast. Today with us, we have Diabetes Reversal Guru of Gujarat, Dr. Kirit Kubawat. Welcome to our show.
Thank you.
He is a medical director at Dia Happy, a reversal diabetes clinic in Ahmedabad. With his expertise, he has helped more than 1,000 plus patients across Gujarat to reverse type 2 diabetes. Welcome.
Thank you so much for inviting me for this talk. I think it will be fun to talk with you regarding diabetes in general and diabetes reversal in particular. So thank you for inviting me.
Great. So, diabetes is an epidemic. We see millions of people in our country, also in our state, like lakhs of people suffering from it.
Right.
Every house will have one issue.
Right.
But why does it happen to so many people, and how has it spread so much?
Right. So that's a very important question. So rather than epidemic, now I would call it as an endemic. So it is prevalent throughout the years, throughout the countries, throughout the world. So it is no more an epidemic, it's an endemic. It is everywhere. The reason why it has been increasing very fast in India, so multiple reasons. So one of the reasons is genes, that we have a particular type of genes in our Asian population which are prone to develop diabetes. That is one of the reasons. Second reason is our lifestyle. You must have been observing in the society. We are gradually adopting the Western type of lifestyle.
Yeah.
Now this has put lot of stress on our physical body, our food habits, our exercise habits, our sedentary lifestyle. So multiple things combining into one.
But what are the symptoms of it? Because it's a silent killer.
Yes.
So we don't see the symptoms so often, but we still need to know if we get it, then what are the first symptoms we see and the gradual ones as well.
Right.
Okay.
But the general symptoms which people could have is increased thirst, increased food intake, increased urination, tiredness, difficulty in vision, tingling or numbness. So these are the few symptoms that patient could have. But majority of them, they might not have any symptoms, still could have a serious level of diabetes. That's why it is known as a silent killer.
But if they don't have a symptom,
Yes.
and if it has reached to a serious stage,
Right.
what happens then?
So again a very important question. So that is the reason why people should get themselves tested at a very early stage. See, initially diabetes used to develop after say around 40-45 years. Now that age has come down to 10 years earlier. So now people develop diabetes even at the age of 30 years. I'm talking about type 2 diabetes.
Yeah.
And forget 30 years, even the children who are not having type 2 diabetes in their adolescent life, even they, because of obesity, now they have started developing type 2 diabetes even at the age of around say 15 to 20 years. So the earlier you test, the better, because it is a silent disease. People would not know for many years that they have diabetes.
But usually the mentality is we only do the test if we have something.
Yes.
But now we don't know if we have this or not, if we are pre-diabetic or if a kid has it or adult has it.
Right.
Then what do we do to make sure that we test every probably 6 months or 1 year?
So I think the people, your question is that who should test?
Yeah.
So there are certain guidelines. So if you have a family history of diabetes, you must test. If you are having a very sedentary lifestyle, you must test. If you are obese, you must test. If your lifestyle is not regular, if you have a lot of vices, then these are the, or if you have some type of symptom, then you must test.
Right.
Yeah.
So diabetes is like the center, and then many things around it.
Yes.
Obesity, then we have hormone issues,
Yes.
we have weight loss, muscle loss, multiple things.
Multiple things.
So how does it combined create so much of effect in the body?
Yeah. So I would personally cause diabetes as the mother. So there is one mother and there are multiple children. So diabetes is the mother of so many diseases. So if you have diabetes, by default you will have high blood pressure. By default you will have cholesterol. By default you will have obesity. By default you could have PCOD. By default you could have a thyroid problem. So multiple things.
Underlying is diabetes
Yeah.
or underlying is that?
So it is interconnected. So person who is obese is likely to have diabetes. Person who is having diabetes is most likely to be obese. If you have diabetes, you are more likely to have thyroid disease. You are more likely to have PCOD. You are more likely to have high cholesterol, high blood pressure, heart disease, eye disease, kidney disease. So basically, diabetes is a mother of multiple diseases.
Right. And all those disease will have a symptoms which are seen.
Yeah.
So once we see that, we should get ourselves.
No, it is a late stage. It is very late.
It is a very late
So before you see those symptoms, so that's why I said that you must try to test yourself at a very, very early stage, depending on those criteria which I told you. So if you are falling into any of those criteria, irrespective of symptoms, you must get yourself tested for diabetes and multiple other things.
Right. Can you explain in the physiological manner the diabetes as a whole and how insulin works in the body?
So basically, there are three types of macronutrients that we eat. So carbohydrate, proteins, and fats. These are the main three macronutrients, and of course there are micronutrients. So we will not talk about those. So these are the three main ingredients which we take. So whenever you take glucose, carbohydrate, which may be either the refined carbohydrate or a complex carbohydrate, when it goes in the body, it is broken down into sugar, absorbed in the body, goes to the liver, and from there, right from mouth to intestines, the signals starts coming to the brain, and pancreas secretes insulin. So as soon as you have glucose, the pancreas starts secreting insulin to digest that glucose, and both these things they match, and ultimately the sugar is utilized in a normal physiological way, and you don't have high rise in the blood sugar because there is insulin to control that sugar and digest that sugar and utilize in the body as a fuel. So what happens in type 2 diabetes is that you take glucose goes into the blood, pancreas secretes insulin, or it might secrete more insulin, that is what we known as insulin resistance. But this insulin is not able to take care of glucose because there is insulin resistance. So whenever glucose tries to enter the cell, there is a blockage. In a very simple language, if I explain you, so that insulin is a key and there is a door. So you need a key to open the door to let the glucose inside the cell. So now this insulin is rough or it is not working. That is technically we call insulin resistance. So in spite of having insulin, in spite of having high insulin, the glucose is not able to enter the cells and it is not being utilized by your body. So ultimately this glucose is diverted to convert into fat. Now this fat is deposited around your vital organs, in your arteries, and ultimately it will cause either high blood pressure, high cholesterol, heart attack, multiple things.
Okay. So pancreas are affected.
Right.
When due to that the insulin resistance happen.
So not only pancreas, the pancreas and the liver. So even liver is a very, very important organ. So in diabetes, type 2 diabetes, liver becomes your sugar factory.
Oh. Okay.
So what happens is that
Because it's a fatty liver.
yeah, it's a fatty liver. So what happens during fasting stage, especially when you take dinner, so for almost 8 to 10 hours you don't eat anything. Still, when you test the blood sugar in the morning, in the fasting state, it is high. So why it is high? In spite of not eating anything, that is because of your liver becomes sugar factory. It secretes lot of sugar in the sleep. So when you wake up, you will have a lot of sugar. And this is one of the main factors in type 2 diabetes.
Right. So for that we have to take the medications in the morning as soon as we wake up.
So either medications,
And then we start the day.
Yes. So right from the morning, you will need something to control your fasting blood sugar, which normally does not happen in a normal person.
A lot of people say that it's not curable.
Right.
but we have seen some studies which are coming up now saying it is manageable.
Definitely.
So, what are your comments on that? Is it manageable if we really take care of our food or exercise and medications, all of it?
Yes, exactly. So type 2 diabetes, I think we'll talk about type 1 diabetes and type 2 diabetes to differentiate. So type 1 diabetes, practically there is no insulin. So those people have to be put on insulin and lifelong insulin. So they are manageable, but they are not curable, they are not reversible. So type 1 is out. So 100% lifelong insulin. That is the only answer. Type 2 diabetes. So it is not curable, but it is manageable and it is reversible. So if you control your food habits, your exercise habits, your weight, multiple things make your life regular, then it is not only manageable, but it is also reversible.
When you say reversible, that means you can go on without medication as well,
Definitely.
if you follow.
Yes. So if a particular person follows the guidelines of management of type 2 diabetes, they can not only decrease or stop their insulin, they can also stop and decrease their medications. So without insulin, without medications, they can be managed for type 2 diabetes.
Okay.
Yeah.
But a person who has been through long years of being a diabetic suddenly has to change everything
Right.
from that day when he knows, okay, he wants to reverse it. It is not easy. It takes time and also it takes a lot of dedication. So
Yes.
how can we motivate them?
Yeah. So as you said, people presume to be a very difficult task, but it is not difficult. Basically, what you need is a lot of time to talk to the patients, which we doctors don't do, because we have a lot of patients waiting in our OPD. We don't dedicate that much time to our patients. So that's why, that is one of the reasons why I changed my practice from routine type 2 diabetes practice to a sort of RMSN type of practice. So basically what we do is that we give a lot of time. So we take almost 1.5 hours to sit our patients, explain them everything. We teach them, we guide them, we handhold them, and then take us through the whole journey with us. Then and then it becomes possible, because you need a lot of motivation, lot of education, lot of dedication, lot of compliance. Then and then this would happen.
Right.
Yeah.
But person who has diabetes has a sort of fear because he or she knows that if he's gonna have this, there is a sugar spike.
Right.
So sometimes that becomes like a strange relationship with food. They don't want to eat.
Right.
But if they don't eat, they cannot manage it. So they have to eat. But this is confusing for them and it is stressful for them.
Right.
So how to deal with that?
So I think there comes the roles of not only doctors but people like you, is the dietitians, the nutritionists, even the stores. I think it's a wonderful idea. That such stores, I think they should be there around the city and everywhere, or maybe even online. So once suppose a patient comes to me, I guide him for a certain type of food, but then from where does he get that food? So that is the most difficult part. It is very difficult to prepare a certain kind of food for one person in the family.
Of course.
So these types of store, that is food pharmacy, that would help a lot to people. So it is very easy for them to procure the food, follow the advice of the doctors, and then manage their type 2 diabetes.
Right.
Yeah.
Does stress increase the sugar spike?
Yes, definitely. So I'll give you one very simple example. Suppose if you go in a jungle, you are all alone, you don't have any gun or any instrument with you to fight a lion which comes in front of you. So what would happen in such a situation? So there are only two things you can do. Either you can fight with the lion, or you can take a flight, that is run away from the lion. So this particular point of time, it creates a lot of stress in your body. So this stress is useful. How? So by this stress, you will have a lot of stress hormones in your body. You will have a lot of glucose in your body, and either you will have that strength to fight the lion because of that extra amount of glucose, or you have a flight to take, or you can run with the help of this glucose. So this stress was useful. Now think of a similar situation in the society or in your office or in your family.
Yeah.
You have a boss who is constantly nagging you, which causes a lot of stress within your body. But then what do? Do you fight with your boss? You cannot fight. Do you run away from your boss? That does not happen. You are stuck there. So this stress produces a lot of hormones. This will give rise to high blood sugar. And when this happens very frequently, ultimately it will cause obesity, hypertension, diabetes, cholesterol, everything. So this stress is very bad in that way.
Because we end up eating food to feel good.
Yes.
And we eat anything then.
Yes.
We don't look at
Yeah.
what is it in.
So that causes a lot of other things and obesity and then ultimately diabetes.
So if we manage our stress levels, do you say that we can manage our future scope of having and not having a issue like that?
So see, stress is just one tip of the iceberg. So just by managing stress, you cannot control your diabetes, or you cannot prevent your diabetes. Stress is one thing. So there are multiple things. As I said, genes. The genes you cannot change. Stress, of course, you can manage. Food habits you can manage. Your exercise you can manage. So these are things which are manageable. So you have to manage multiple things to stay away from diabetes. And of course, stress a very important factor.
But it's easier said than done.
Yeah,
When we are in a situation of fight or flight,
right.
it's not easy to take a call because there is fear, there is anxiety, there is lack of support, so many things.
Yeah. So say in the example of jungle which I gave you, it's a question of life and death. So you take the decision very easily, very fast. So when you come to the real life situation, you don't have that fear of dying immediately. Long term is of course a different thing.
Yeah.
So because of this lack of fear, it's a bad thing. Because people don't realize, because they don't have symptoms. It's a lifelong process. It will take many years to cause harm to your body. And once that harm is caused, it is very difficult to come back to the normal stage. So that's why these diseases, the lifestyle diseases, they are silent but they are dangerous.
How is the demographic of this
Yeah.
disease, which
Yeah, so if we talk about the world, there are crores of people who are having diabetes. But let us talk about India. So India has got almost 10 crore people with diabetes, diagnosed diabetes. There are 10 crore people who are having pre-diabetes, those who don't know that they are going to develop diabetes in the future. So it's double the population. If you go region-wise, then if you go from South India to North India, the highest number of people having diabetes is in South India. Once you go up, Kerala. So from Kerala, if you go up towards north, towards Kashmir, the incidence of diabetes, for some reasons, they decreases. But if you take overall figures of India, so it comes to almost around 15 to 17% of the population. They could be having type 2 diabetes. If we talk about Gujarat, very huge number, very huge number. If we talk about particularly Ahmedabad, the city where we are living, so almost 13 to 50% of the patients, they are having diabetes, type 2 diabetes. And equal number of patients, they are having pre-diabetes. So double the population.
that's a huge number.
Very huge number.
In the city itself.
Yeah, in the city. So just count the numbers. So maybe around 15 lakhs or 30 lakhs.
Yeah.
Very huge number.
And a lot of them, they don't know that they have this.
Yes, so that's the biggest task. So
To
there's
educate them is one thing.
yes,
And motivate them to live a healthier lifestyle.
yeah. So I think the most important thing is to diagnose. So I think people, maybe the authority or NGOs or people like us who are into this field, they must very hard to at least get them know that they have diabetes.
Yeah.
Teaching and then treating and managing and reversing comes very late. But at least they should know that they have diabetes.
Talking about insulin, so a person when he or she has insulin resistance, they have to be kept on insulin or they can start with the medication.
So the scientifically, step one is lifestyle, compulsory for anybody and everybody type 2 diabetes. Then usually we put on one of the medications. The most common is metformin.
Yeah.
So metformin. So there are multiple medicines. The best thing of managing diabetes is that you have lot of choices. If you want to go from Ahmedabad to Mumbai, there is only one way.
Not like a good choice.
Yeah, so you have multiple choices to treat. So it is fun to treat diabetes with medicines because you have a lot of options. There are 10 things where you can attack diabetes. So you have metformin, you have sulfonylureas, you have AGIs, you have SGLT2 inhibitors, you have DPP4 inhibitors, multiple things. So step by step, depending on the patient's need, requirement, and the indications, you start a certain medication in a particular patient. So that is the way we take it. So lifestyle, medicines 1, 2, 3, 4, whatever number. If not controlled, ultimately then we go to insulin.
But a person who's given a medicine is also given a medicine for cholesterol. It's a combination.
Yeah, it's a combination. So as I said before that diabetes is a mother of multiple disease. So once you have diabetes, you are likely to have, and by and large you will have high cholesterol, high blood pressure, maybe even thyroid. So all these medications, depending on their presence and indications, they are given along with diabetic medications.
What is the unit of insulin if we have to understand? When does the insulin start?
Okay, so once you give the full maximum dose of a particular medicines or a multiple number of medications, and still if you are not able to control the fasting, PPBS and HbA1c, that is the stage when you think of insulin. That is one thing. Then there are certain indications even before that. If somebody is undergoing surgery, if you want to have the control very fast in few days, person is put on insulin. If there is some emergency, patient is put on insulin. If there is pregnancy and diabetes, again insulin. So there are certain indications of putting on insulin beforehand also. So these are the emergency situations. But otherwise, after medications, when they fail.
And there are a lot of devices now which comes to monitor the blood sugar.
Right.
So what do you think of them?
So I think the glucometers are one of the most common and most famous devices, which I think almost all the diabetics, especially type 1 diabetes, they would have. So they are very convenient, easy to carry, gives almost perfect result. So glucometers are one thing. Of course, lab tests are there, but then you have to go to lab or somebody has to come and collect the blood. So glucometer is very, very convenient. Second thing is which has happened very nicely is a small chip which you attach to your body, that is known as CGMS, continuous glucose monitoring system. So which we use routinely in all our patients. So that's a wonderful device. So just by putting that device on somebody's body, you can measure the blood sugar every 5 minutes. So it measures the sugar by default every 5 minutes for a maximum up to 14 days. So
we can
yeah,
know what food gives us
exactly, yeah. So that's again a very important thing. See, till now what we were doing as a diabetes doctors, that we were going to give blanket advice to everybody. X, Y, Z having diabetes, these are the foods that you are supposed to eat or not to eat, which is wrong. People say that millets are very good for diabetes, but then that is not true for all the people. We have people in our practice who have spikes because of millets. They take millets and they have a lot of spikes in blood sugar. So
But
they,
millets are low GI compared.
yeah, that is, yeah, they are low GI. But then if you take the GI of say bajra and wheat, they are almost same. So wheat GI is say 71, bajra is 68. So what is the difference? Just 2, 3, which people don't know. People just know that millets are good. So for a particular person, particular millet might give even a almost equal rise in blood sugars after consuming. So this CGMS is a very, very useful instrument which would give you the exact spike after a particular food. One more device which is going to come in the market is non-invasive glucometer. So at present what we do is that you need to prick a finger, take the blood drop and put it on the meter, then you get the reading. So now you have non-invasive glucometer which might come in the market very soon. So you don't need to prick, you just need to put it on your wrist, on your finger, and you get the blood sugar result. So still not very successful, but it will come and it is going to change the world.
Yeah, of course.
Yeah, especially for children who are having type 1 diabetes, it is very, very painful for them to prick 4 or 5 times in a day, apart from insulin. So I think this device will make a wonderful invention.
Can you explain us the level of our blood glucose in the morning and after having food? What it should be and what is the safe?
Right. So I think you are trying to differentiate between a normal person and a diabetic.
Yeah.
So normally the fasting blood sugar should be less than 100.
Okay.
So between 101 to 126 is pre-diabetes. More than 126 fasting is diabetes.
Okay.
Similarly, sugar after a meal, it should be less than 140. So if it is between 140 to 200, it is pre-diabetes. If it is more than 200, it is diabetes. HbA1c, 5.7, less than 5.7 is normal. From 5.8 to 6.4 is pre-diabetes. More than 6.5 is diabetes.
So there has been a study where we have seen that insulin resistance and diabetes can be cured and solved if there is a surgery for bariatric. So is it true and is it efficient enough?
Right, now it is very much true. So I think it was an accidental finding. See what happens in bariatric surgery is that once a patient is taken up for bariatric surgery, you do the surgery and you will not imagine that maybe on the second or third day your diabetes would go. It's a magic. So how does it go? The weight does not decrease in 2 days. Does it decrease after surgery? It can never. So there are certain gut hormones. They are known as GLP and GIP. So when you do a bariatric surgery, these gut hormones are altered, and this alteration gives rise to a different phenomenon, interaction between the hormone and the pancreas and insulin. So this would help in activating insulin secretion as well as the action, and it also acts on the brain. So this would help to control diabetes or even reverse diabetes. So till now we were taught in the medical college that diabetes is not reversible, it is a progressive disease. But when bariatric surgery came into the market, it is proven beyond doubt that type 2 diabetes can be reversed. But if you ask me for an indication as a treatment, I think I would not recommend bariatric surgery just to cure diabetes. It is just a finding and it is proven beyond doubt it can help.
But a person who has had a surgery and the diabetes is magically gone, it tends to come back if they don't take care of their diet and lifestyle.
Yeah, so once the bariatric surgery is done, I think it is a lifelong process. The person has to follow certain food habits and lifestyle throughout the life. If they don't follow, if they regain the weight, then there are all the chances that diabetes would come back.
It would come back.
Yeah, it would come back.
And then again, the person has to be put on the medication.
Yeah. So it's a very, very tedious thing to do.
Yeah.
So that's why we don't promote bariatric surgery as a
shortcut.
Yeah, it's a so it gives a magical result, but then it is not that easy to do it. Even the cost is involved, physical stress is involved, lot of things are involved.
So we spoke about the reversal via a surgery. But is reversal for diabetes possible through food and through managing the lifestyle?
Yes, definitely. So I think that is what we are doing. So as I said you before that I was into this practice of diabetes since last 30 years. But then what made me change my practice to diabetes reversal? For a simple reason. That I have been studying since many years that a lot of my patients, not only my patients, the patients world over, in the best of the country, in the best of the setup, with best of the doctors, with best of the medications, still in the whole world, only 30% of the patients, they are well controlled. 70% of people are not controlled. So there has to be some fault somewhere, either with the doctors or with the medications or with the patients. So I tried to study that. So from this study and by many people around the world, what they found that lifestyle disease, diabetes is a lifestyle disease. So if you manage with lifestyle, that is food and habits and of course exercise and weight management, you can manage diabetes without medications. So we started experimenting on our patients. And now we are into full-fledged practice of reversal of diabetes, and we must have reversed more than thousands of patients through this practice. So no insulins, no medicines, just through lifestyles we have been able to get the results.
But what is the stepwise methodology for reversal? How do we start?
Yeah, so it is not as easy as I told you. It does take a lot of time. So it needs a lot of time to educate the patient first. You educate, motivate not only the patient. We don't treat a single person. We treat them as a family. So whenever we consult, we call the whole family, at least the husband and the wife, minimum. So they must understand what exactly diabetes is, what is lifestyle, why lifestyle is important, why weight management is important, why sleep is important, why stress is important. So all these things we try to teach them. So the whole process takes almost 6 months to come to the reversal point. But practically, once we enroll the patients and when the patient is motivated, we have seen that almost 80 to 90% of the patients, they get reversed within 2 to 3 months if they follow. So it is not very difficult. It is very, very easy once the patient understands and follows.
Right. So sometimes it's difficult to follow and sometimes it's manageable to follow.
Right.
But this process is also dependent on how strong you are internally.
Yeah.
How strongly you want to reverse it.
How motivated you are.
How motivated we are.
So that is the most important because not everybody can do it. So unless you are motivated, unless your family is motivated to help you and guide you, we are always there as a team. So we have the whole team from doctors to dietitian to nutritionist to counselor to educator plus the support system and of course the technology. So we take maximum advantage of this whole team in the family to help the patients to reverse. And by and large, whoever comes to us, they have some motivation. So we just need to push that motivation and they are able to do it.
Okay, wonderful. So starting with food, which are the foods that a person has to avoid in the first line itself if they want to recover from diabetes?
So if I give you a general guidelines, then of course refined sugars, they are the most dangerous. So in fact, these sugars are equivalent to cholesterol. That is what we say in the practice. So sugar for us is a poison. So refined sugars we totally avoid by default in each and everybody. Then there are certain grains like say wheat. So wheat and maida we totally avoid. Potatoes because it has got lot of carbohydrate we avoid. There are certain fruits like banana, chiku, mango which we try to avoid. These are known as high glycemic fruits. So that is what we avoid. Fruit juices. So I think one must understand the difference between glucose and fructose. So there is a lot of difference between, though they are carbohydrates, there is a lot of difference. So if you ask me personally, I would cause fructose is the most dangerous element for diabetes and obesity. Fructose for me is a poison. People say that fruit juices are very healthy. I say fruit juices are poisons.
Because it spikes fructose and fructose spikes.
Yeah, so no. So fructose is the only, fructose is only metabolized in the liver in the whole body.
Right.
Glucose is metabolized throughout the body, but fructose has got only liver to be metabolized. So if you take a lot of fructose, lot of fruit juice, it is metabolized in the body which liver cannot handle. So if once it cannot handle, it turns the liver into fatty liver. Once it spills out from the liver, it goes to the visceral fat. It is deposited as visceral fat, which is the most dangerous fat for the body.
The stubborn fat.
The stubborn fat. So I think fructose is the culprit.
Which are the foods that have the highest amount of fructose?
All the fruits.
All the fruits.
So all the fruits in a fruit juice rather, not fruit but fruit juice, because fruit as a whole is good because it contains a lot of fiber. So if you consume some amount of fruit in the normal stage, it is maybe good. But if you consume fructose, which is fruit juice, then it could be dangerous.
Okay. And about vegetables and dals and pulses, these are safe foods.
Yeah, they are
for
safe.
diabetic.
They are safe. They are very safe. So any vegetables containing a lot of say fibers, they are very good for diabetes. So in fact, any fiber containing food is very good for diabetes. Not only for the patient, it is also very good for the gut bacteria. So as glucose is the energy for us, fiber is the energy for the gut microbiome, which is very good for the body. So there are millions of bacteria in our intestine, which we known as gut microbiome. It is the whole separate organ. So we have heart, we have brain. You have a gut microbiome, which is an organ, a very huge organ. They are very useful for our body, and they need fibers to survive.
Right. And after a person who has a diabetes has taken a lot of medicine throughout his life.
Right.
So the gut microbiome is depleted because of the medicine.
Yeah. So especially antibiotics. So when somebody consumes a lot of antibiotics or maybe even other medicines, they are going to harm gut microbiomes. They are going to alter gut microbiomes, and by altering gut microbiomes, you will have a lot of disease.
Okay.
You must have heard about gut feeling.
Yeah.
So what is gut feeling?
The second mind, right?
Yeah.
It's
So
not the second mind.
it is second mind, and it is the bacteria. So this bacteria controls your whole body, like the brain. So it is a second mind. They prepare and produce lot of hormones. So these hormones, they again go to brain, and then through brain they act. So it's a second brain.
Of course. Correct. So, you've spoken about the reversal, stepwise reversal procedure for a diabetes, and it roughly takes between 3 to 6 months
Yeah.
with the right kind of motivation and with the right kind of approach.
Yes.
And under the expert
Guidance.
this has to be done under a medical
Guidance
so that
only.
the medicine is also changed as required, and
Yeah.
the food which can spike your sugar and control your sugar is known.
Known. Yes.
So what about intermittent fasting for diabetics? Does
Very.
it help?
Yeah, it is very useful. So I think since many years in almost all the religions, you see any religion of the world, whether it is Hindu, Muslim, Christians, or Buddhist, or any religion, they promote fasting. So why do they promote fasting? So they were very intelligent people since thousands of years. So fasting helps in many ways. Diabetes is of course one way, obesity, cholesterol, blood pressure, everywhere.
When a person who has a diabetes is scared to fast because it might change the sugar in the blood and they might probably faint or something.
So see,
they have this scary thought, right?
yes, so people are scared of fasting in diabetes. But if it is when it is done under a medical guidance, under a doctor, it is a boon. So fasting is the treatment for diabetes. But people are scared, so they are scared to do it. But we promote it. So we promote it in a scientific way. You cannot do it roughly. It has to be done under a guidance in a proper way. So there are various ways of fasting. Intermittent fasting could be intermittent time-related feeding. What we call it as time-related feeding, TRF. So either it is say 16/8. So for 16 hours you don't eat, for 8 hours you eat. Or it could be intermittent days. So one day you eat, one day you don't eat. Third day again you eat, fourth day you eat. Sometimes people promote 2 days in a week. So 2 days in a week you don't eat, 5 days you eat. So there are various ways of doing intermittent fasting. So they must be done in a scientific way, not haphazardly. Then it definitely helps.
And it has given a successful result.
Very successful. So
Easy to follow for a person who has
initially it becomes
food issues, because
yeah.
a diabetic is also hungry sometimes. And
Yes.
sometimes they're thirsty and multiple things.
So I'll tell you something very interesting. So see, there are two things which happen by fasting. So when somebody fasts, it promotes ketogenesis in our body. That is what we call as keto diet. So rather than taking keto foods from outside, when you fast, your body goes into depletion of glycogen and glucose. So now your body starts producing ketones. So ketones becomes a secondary source of energy for the body, and it will give you a lot of energy. So when you fast, rather than you becoming weak, you will have a lot of energy because of ketones. So that is one of the ways of controlling sugar and reversing diabetes, where it helps.
On the days we are fasting, the medicine is not taken.
So it is modified. It is modified. So for that particular period, the medicine is modified. And one more thing, in the brain there are two centers. So one is the eating center, and one is the thirst center. They are lying side by side in the brain. So brain is sometimes fooled by drinking water. So when you drink water when you are fasting, your brain feels that you are feeding. So you don't need to feed yourself. So when you feel hungry, don't eat. You drink water. So your brain is fooled that you are eating something and you will feel good
Okay.
just by drinking water.
That's a trick.
Yeah, that's the trick. So you can fool your brain.
But would intermittent fasting in diabetic reduce weight?
Definitely. Definitely. So not only the glucose. See, why it reduces weight is that whenever you deplete your glycogen, which is very for a short time, and glucose, you are start utilizing your fat, which is stored in your body. So when you start utilizing your fat, especially the visceral fat, naturally your weight is going to go down.
But we have seen some people who have diabetes and have weight loss.
Right.
Is wasting as well.
Right.
So for them, what would be the right thing to do?
Yeah, so again, this is very, very important. So what you are talking about is sarcopenia. So every patient of diabetes, they would have sarcopenia, which is not noticed by many people. So when there is weight loss, people would feel happy that there is weight loss, but it could be because of sarcopenia. So sarcopenia is loss of muscle mass. So muscle is a very, very important organ for control of diabetes. So you don't need to just reduce fat, you need to increase your muscle mass through proteins or maybe through gymming. So when you take protein supplements or you do a strengthening exercise, it is going to increase your muscle mass. Your muscles are bloating papers for glucose. So when you increase your muscle mass, it will suck more glucose and thus control your diabetes and reduce your blood sugars.
So weight training is one thing you
Very-
like to promote
Very, very important. Very important.
for a person who has wasting issues.
So that is a part of lifestyle. Yeah. So sarcopenia is one of the most important factor in type 2 diabetes, which people don't realize, and which needs to be treated through proper diet and protein supplement.
What is a circadian rhythm in our body?
Right. So you have heard about biological clock.
Yeah.
So biological clock is a circadian rhythm. So basically what happens in our body, that we are tuned to a particular type of lifestyle. At certain time you feel sleepy, you go to sleep. And certain time of the day you wake up. So there is a clock inside your body. So this clock guides you to go to sleep and then you wake up.
Yeah.
So if you talk chemically, what is the chemical which works? So it is melatonin. So whenever there is a dark, once the sun sets, there is a dark. So melatonin level starts rising, and this melatonin induces sleep, and you go to sleep. As soon as there is light, there is sunrise, this melatonin level would go down, and you wake up. So this is a normal biological clock. Now what has happened in our life, that there is no darkness, you have light everywhere. When you go to your bedroom, you see your mobile, there is a lot of light through your eyes. So this melatonin level is disturbed. So the sleep is disturbed. And this disturbed sleep gives rise to so many complications in our body, including high cholesterol, high blood pressure, high blood sugars, obesity, lack of sleep, lack of mood, lack of energy. All these things are disturbed because of disturbed in the circadian rhythm.
Which is melatonin.
Yeah, which is melatonin.
Melatonin based.
Melatonin-
And melatonin is a hormone.
It is a hormone. So it is a hormone which is secreted from the pineal gland in the brain. So it is light dependent. So there are certain receptors in your eyes, and there is something known as suprachiasmatic nucleus, which is there in your brain. Through that nucleus, it would act on a induce sleep or the wake cycle. So whenever this circadian rhythm is disturbed, the body is disturbed, and you have a lot of problems and the diseases. So to maintain this circadian rhythm is again very. So sleep. So sleep is one of the most important factor, especially in diabetes management.
8 hours of sleep?
Yeah. So minimum 8 hours of sound sleep is very much required to control your blood sugars.
But what happens to a person who has sleep issues, insomnia?
So there are various ways of doing it. So one is of course lifestyle, yoga, meditation, exercise, when to take food.
If a person is working, doesn't have time to do all of that, what happens then?
Yeah, so there are certain factors which are beyond the management level. Certain people have shifts, so they have to work in the shifts. Sometimes they would have day, sometimes they would have night shift. So for these people, of course, it is going to cause problem. So it is very difficult to manage because you cannot change that lifestyle. But people who can manage their lifestyle, they must follow this circadian rhythm. Still, if they have issue, then there are certain supplements. There are certain like say magnesium that would help. Certain diets that would help. Certain exercise, yoga, meditation that would help to induce sleep. If these do not help, then there are certain medications which may be needed to be used for sleep. So there are multiple things.
8 hours of sleep is very important to maintain a healthy lifestyle and prevent us from diabetes and other
Issues. Yeah. So sleep is one of the therapy. So we don't take sleep as a sleep. We take sleep as a part of therapy. So in all our patients, we ensure that they get a good sound sleep. Yeah.
Okay. For diabetes, the food solution would be what? Ideally speaking.
So see, if you see diabetes as a disease, so people correlate it with carbohydrate, which is of course true. But that is also a disease of protein and fats. So diabetes is not just carbohydrates, mainly carbohydrate, but carbohydrate, proteins and fats. So basically we focus more on carbohydrates because that is the most staple food that we eat. Most of the foods they contain lot of carbohydrates. So we can focus and control carbohydrates. So taking low carbs food is one of the most important way of managing diabetes.
What is the definition of low carb food?
So you know something known as GI and GL. So every food has got a particular GI and particular GL. So GI is the glycemic index of a particular food, and GL is the glycemic load of a particular food. So if I give you example of say watermelon. So watermelon, if you take GI, it is very high. So by definition, a diabetic patient cannot eat high GI food. So it may be said that you cannot eat watermelon. But if you look at the load of watermelon, it is very low. So a person of diabetes, though having high GI, can eat watermelon because the load is less. So there is a difference between GI and GL. So every food has got a GI. So something which has got a GI of less than say 50 or 55 is good for a diabetic. If the GI is say from 55 to almost 70, it is moderate. Now if the GI is more than 70, say for example wheat, it has got a GI of almost 71, 72. So it is bad for diabetes, even rice. So any food which has got high GI, it is bad for diabetes. Moderate GI should be avoided and low GI foods should be promoted for a diabetic.
Okay. But when we go out and shop,
Yeah.
it's little tough to
Very
find
tough.
the right kind of low GI, high GI food.
Yes.
Unless and until we know we are from a
Yes.
science background, we know food and all, we'll know okay this thing has more GI and less.
Right.
But if we have to talk to normal people, common people who are also suffering from this issue,
Right.
how can we help them to educate themselves and pick up the right product from the shelf?
Right. So I think this is the most important question because not everybody is a science graduate student and not everybody knows about GI and GL. We as a doctor know that what is GI and what is GL. So for a common man it is very difficult. So what you can do is that you can teach them about GI and GL concept. They can Google it and find out which are the low GI food. So that is just getting the names. Now, how do they get it? So I think the concept of this food pharmacy is a very, very important concept. That we must have food pharmacy stores across the city where they can go and get the food of their choice. Because again, taste is a very, very important factor in a person's life. You might guide them to a low GI food, but if he is not palatable, if he doesn't consume, then it is not going to be very useful for him. So there must be food pharmacy stores across the city where they can go search the food that they like, which is palatable, and still it is having low GI or low GL, and that food they can consume. So this would, I think, would help. So educating and guiding them to a particular place to find the particular type of food.
And the base would be simply, the first line would be to avoid a wheat-based product
Yes.
and a rice-based product.
Yes. So, yes. So they are high GI foods. So then now in the markets, certain types of rice and wheat they are available, which have been developed as a low GI rice or low GI wheat, which people don't know. So if they can be guided to these types of food which are available in the food markets, food pharmacy, I think that would help.
Food pharmacy, we do have low GI
So I think
rice.
that would help this.
GI wheat
Yeah,
as
so, yeah. So that would help. That would help a lot.
This brings us to the end of our podcast.
Right.
And we have learned so much from you all about diabetes and the major part, the reversal of diabetes,
Right.
which is need of an hour, because
Very
we
much.
have to jointly educate our patient who has this issue and make sure that they can eliminate it from the root
Right.
and motivate them to do it, and that would help them, their life, they'll change their lives.
Right.
And also it will help the family
Exactly.
be happy and healthy, and the next future generations as well. I think what we have learned from the discussion today is food is the problem and food is the solution. Wrong food is the problem and right food is the solution. And in order to find that right food which is suitable for your body and your health, we need expert guidance and expert care. So please do approach the experts around you. And today we are honored to have the diabetes reversal guru of Gujarat with us. It was a wonderful podcast. Thank you so much. Stay tuned until the next podcast. See you.